Thank you very much, Mr. Chairman, and I thank all the witnesses for their testimony. I'm not going to talk about rainbows and unicorns. In Kentucky, we prefer to talk about thoroughbreds. So I'm going to talk about rainbows and thoroughbreds because Kentucky has had one of the truly successful and mostly problem-free experiences with the Affordable Care Act and our exchange called Connect. And our Governor, Steve Beshear, and his team deserve an awful lot of credit. We had a glitch the first morning of the operation of the exchange for about 2 hours, and access was limited. Beyond that, we've been pretty much problem-free. And our experience is that we have insured now more than 500,000 people under the Affordable Care Act through our exchange and expansion of Medicaid in the 2 years of operation, and that's in a state of 4.4 million. We've reduced the uninsured rate by 50% statewide. In my district, we've reduced the uninsured rate by 81%. There are only slightly less than 20,000 uninsured citizens in my community of 750,000. Which is a little less than 3% uninsured rate. So how's that happened? It's because of the outreach that we all talked about. Connect had people in every county fair and every neighborhood association meeting at the community health centers, you name it, where people gathered, they were there explaining and helping people enroll. So I'm very proud of that. As a matter of fact, it's been so successful in Kentucky that one Republican state senator has suggested that we try to expand the exchange to other states. So we may be coming after your business pretty soon. Additionally, just since I get to act like a witness here and talk about our experience, we do have this year 3 new insurance companies coming into the exchange, which is positive. Now our consumers will have, I think, either 6 or 7 choices of providers. There are 3 new insurance companies in the private marketplace, so the market is actually expanding in a lot of ways. And I think most importantly, earlier this year, our governor commissioned the Deloitte firm to do an assessment of what the economic impact of the Affordable Care Act would be over the next 5 years. And Deloitte came back and said that over the next 5 years, the Affordable Care Act would create 40,000 new jobs in Kentucky, would create additional economic activity of $32 billion, and have a positive impact on the state budget of over $800 million. So I think in virtually every sense of the word, the Connect operation and our experience in Kentucky has been very, very positive. We're getting an incredible increase in preventive medicine. We've had screenings for breast cancer increased by 111%, cervical cancer screenings by 88%, colorectal cancer screenings 108%, and physical exams are up 187%. But all of this is really not as important as the human impact, and as Ms. O'Toole mentioned a couple of her clients, I'd like to read a letter from one of my constituents, a woman named Kim Atkins. And she wrote, "My daughter Sarah Atkins is one of the several young adults that are on our insurance policy until she is 26 years old. She is still unemployed and looking for employment. On January 9th, 2011, that bill, the ACA, saved her life. One of her kidneys shut down and almost went septic. If she wasn't on our insurance, she would have waited or not gone to the hospital at all. The doctor told her if she would have waited an hour later, she would have lost a kidney or died." And that's what this is all about. This is providing quality, affordable care to our citizens. And I think I'm very proud, once again, of Kentucky and the experience we've had there, the progress we've made, and I thank you for the work that you all are doing in your respective states as well, because this is one of our, I think, can ultimately be one of the true success stories of Congress and the federal government, that we have created this new way to insure Americans. So I thank you all for your work and your testimony, and I yield back.